Good afternoon. My name is Rob Baril. I'm the president of District 1199 SEIU. We represent healthcare workers in the state of Connecticut, about 25,000 altogether in hospitals, nursing homes, group homes, state employees, and home care. And we're here because we are hearing across all of the sectors where we have members concerns about the preparedness for COVID-19, concerns about personal health, public health, and implications for our members as workers themselves. And so we wanted to gather together to communicate around these important issues. We've seen that in places like Washington State, where at the Life Care Center in Kirkland, nursing homes can be, just very dangerous vectors for transmission of COVID-19. There are concerns, obviously, for our bedside caregivers across any sector of the healthcare industry. And so we wanted to make sure that we are communicating what our position is in terms of what we believe is the best for our members, for the people that they take care of, and for the communities where our members reside. We know that there are no easy solutions in terms of COVID-19 preparedness, but we want to raise a high bar so that we are as well prepared as we can possibly be to meet the challenges of the illness. We want to obviously thank Governor Lamont for his leadership in declaring a state of emergency in the state of Connecticut as we prepare for the potential spread of the virus. Governor Lamont indicated that the state will allow workers who are showing symptoms of the illness to take sick time, but not to draw that out of their accrued time, which is very, very important, and that people can request remote work so that there's not any added danger of transmission. So we think that that's a wonderful first step. But we are asking that the state and Governor Lamont help to raise that very, very high bar, the highest possible bar in the private sector part of the healthcare field as well. A couple of very practical concerns are starting to be raised. School districts are starting to shut down across the state. Schools in New Haven, in Hamden, in West Hartford, in Darien, and probably a number of other districts that we haven't heard about yet either have closed or will be closing soon. That will mean that workers will be staying home to care for their children. And so there are concerns about whether people will be disciplined in terms of tardy and lateness and absenteeism. There are concerns about whether there will be funds available for childcare because very, very young children obviously are going to need somebody to stay at home. Many of our members are single parents. We want to make sure that the state is doing everything possible to make sure that there are funds available so that healthcare workers in particular are not having to make choices between staying with their children and showing up at work to make sure that they continue to have money coming in so that they can pay their rent, pay for food, and pay for other bills. We definitely want to make sure that private sector workers are not disciplining employees who are either quarantined or staying home with their ill children. Given how contagious the virus is, we would ask the state to consider establishing protocols to monitor people's temperatures when folks are coming in and out of public places, whether that's state facilities, including state healthcare facilities, or really just any large place of employment or public gathering, including in the private sector. In talking about healthcare preparedness, there's been a lot of communication to hospitals as we understand it. Hospitals are much better resourced than some of the other parts of the healthcare industry. So hospitals have the financial resources to pay for equipment that is just much more challenging in other sectors, group homes, nursing homes, and places like home care where you've got one-on-one consumer and patient settings. And so we want to encourage the state to think about how they're going to communicate around those other parts of the healthcare industry outside of hospitals especially. Home care workers in particular are folks who are receiving their health care in their own home. We represent about 10,000 folks with intellectual and physical, workers who provide care for people with intellectual and physical disabilities that are home care workers. And there's been, to our knowledge, as of yet, no communication from DDS or DSS, which are the agencies that provide for the Medicaid waiver program, to those workers in terms of how they prepare themselves, keep themselves healthy, keep the consumers and the patients that they provide care for healthy. And so we think that that's a particular place of the healthcare workforce where there needs to be communication, and that communication has got to come out in multiple languages, because there are folks who their primary language is either Polish, Spanish, or some other language other than English. So we've got to make sure that they're getting the materials that they need to be able to prepare themselves for the onset of COVID-19 in those languages. Nursing homes are receiving some communication from the Department of Social Services, but again, nursing homes are key transmission points where the elderly population we know is most vulnerable. And we think that the highest possible care standard in nursing homes should be set. So we're working together with nursing home operators to make sure that quality services are preserved, but we want to make sure that that work is expanded. Sick leave, again, is an extreme concern that we have, because if workers exhaust their paid leave, they're going to have to make very challenging choices as low-wage folks in terms of how they're going to be able to provide for themselves and their families. Many nursing home workers, home care workers, group home workers have multiple jobs. So in the unfortunate event that anybody gets sick in one of those agencies or employers, that they may be able to transmit across multiple places. So again, we think that the idea of testing is one that the state should think about very, very strongly. Within state employment, again, there's other challenges that are just based on existing short staffing. So for instance, the Department of Corrections has currently about 150 openings. So how are we going to make sure that our jails and our prisons are adequately staffed with healthcare workers? If there are mandatory overtime that is required of healthcare workers in the prisons and the jails, how are we going to make sure that workers are able to be able to care adequately for their families? So we would ask that there be some consideration in terms of funding to make available for child care for those folks. DEMIS is another state agency where there are just hundreds of openings currently, probably between 250 and 300 current vacancies. So there are already severe challenges in terms of staffing, which will only be compounded if folks are quarantined due to illness, or if there are widespread school closings. So we just are asking that the state continue to be forward-thinking in terms of preparation as we get ready for the onset of COVID-19, and that we do everything possible to make sure that healthcare workers' needs are considered, and that they're able to most fully partner with the state and with their employers to make sure that the people that they care for are getting the utmost of care.
All right, my name is Chelsea Daniels. I work as an LPN at Fresh River Healthcare in East Windsor. I'm a mother of 3, soon to be 4. And my concerns are, how do we continue to keep our residents safe? If schools close, we have to make a choice between our residents and our children. That jeopardizes resident safety and continuity of care. The residents depend on us 24 hours a day, 7 days a week. We don't close. We have children who need care as well. You know, what if you come from a single parent household or a household that only has one income? Who then is responsible? How do you make the decision between going to work or going home to your family? My other concern is for staff safety. We have no adequate way of knowing whether someone has been exposed to COVID-19 or not. This virus can take many days to show symptoms, and we are in constant contact with new people. While we have restricted visitors and a lot of the public, we're still taking new admissions at our facility. My other concern is, what if somebody becomes infected with the virus? Are we going to be isolated in a nursing home for 14 days? Or are we going to be isolated somewhere else? Or are we going to be sent home to our families like that? And then we have our families at home who need us. So that's a big safety concern for us staff members. And we also have a financial concern. And like I said before, many of us, we just can't afford to stay home. So it would be nice to have some form of job stability and to be able to say that if we have to stay home, we can be okay if we have funding from the state. Thank you.
Yeah, talk about when you're talking about taking people's temperature. I mean, do you want people to have their temperature taken as they're walking into nursing homes, as they're walking into any sort of state building or private building?
Look, we're not public health experts ourselves, but in places like Fairfield County, where we know that there are many hundreds of cases in New York, and there are many workers in Lower Fairfield County that actually commute from the state of New York. That may be a place where we should be taking the utmost of precautions, and so we just would encourage that there is strong consideration that is given to providing measures like temperature taking at entry and access points for nursing homes and probably many other facilities as well.
Does that happen, well, with new patients? You were talking about new patients when they come in. There's no testing. So when you guys are admitting new patients, you don't know.
We don't know. It's just a risk that we're taking. And like I said before, a lot of the times the symptoms take a few days to come up. By that time, we've already been exposed.
And are you concerned about, CHIT did a story today in that over the past 2 years, 145 of the 217 nursing homes in the state have had infection incidents. Is that concerning?
Absolutely. It's concerning.
Is there any measures being taken right now as far as, I guess, cleaning and making sure the nursing homes are?
Yes, they've implemented, more cleaning, and we do have a questionnaire that we have to answer before we walk through the door. As I mentioned before, visitors are restricted. The outside public is restricted. We don't have many people entering our building at this time. So while we've limited a lot of the outside public, we're, just in contact with new patients and, of course, the patients that we already have and other staff members.
And can you talk again, do you feel you have adequate supplies, masks? I don't know what other types of supplies exist that would...
Masks, no, we don't. There is a shortage just about everywhere. We have very limited access to masks, but we haven't been denied anything at this point.
Do you know how many do you need, or if you have enough for right now, how far does your stock go down the line?
I don't do supplies, but I know if we ask at this point, we wouldn't be denied a mask or any safety equipment.
What are some other sanitizer, do you guys use that?
Yep, we have full access to sanitizer, gloves. We use personal protective equipment overall in general, so that stuff is still there. We have safety measures in place.
On that question, though, it really varies from amongst the various parts of the healthcare workforce. So, for instance, again, we represent 10,000 workers who are home care workers in the Medicaid waiver system. There is not access other than out of a consumer's budget, and many of those consumers with significant either intellectual or physical disabilities are not able themselves to purchase sanitizers, don't have the resources to purchase the most expensive masks. And so it's just very important that we get some communication out to that workforce from the state to give the best possible guidance to those workers.
And there's been none so far?
None that we're aware of. None that we're aware of.
I want to ask, how confident do you feel this situation's changing very fast, and it may change very fast even within the place that you're working at? How confident do you feel that these messages from the nursing home operators and changes that may directly impact you, how confident are you that they are going to effectively be communicating those changes to you over the course of this outbreak?
Well, I feel everybody is taking it day by day. We don't have all the answers right now, and I think everybody's working diligently to do what they can to keep us safe, but we need a better plan in place. We need to have stability and a peace of mind.
Do any of the specific agencies have testing kits? Like I saw the Department of Corrections said that they were expecting to have testing kits today. Are there nursing homes that have access to these as well? Is that just VOC?
I do not know about nursing homes. That doesn't mean that they do not have them. some of those folks may be positioned to answer those questions. But again, we know that there are significant parts of the healthcare workforce, probably upwards of 10,000 of our members have no access to testing kits through their employer because they are home care workers.
I believe the state of Connecticut only had 2 testing kits available at this time. So I would think that they were in the hospital, not quite the nursing home.
Has anyone, this is obviously something that is sort of a new type of outbreak, but has anybody been here during outbreaks like the H1N1 outbreak that can sort of speak to how maybe nursing homes were equipped to handle something like that, or how have you seen them, nursing homes, handle something like a widespread outbreak in the past? That maybe we can use for a basis of seeing how it might play out this time.
I wasn't around for H1N1, but in reference to your question, we've had, people with the flu, and we restrict visitors, we lock off that part of the facility and limit contact. And usually it's something that kind of blows over, but this is something completely different that we're dealing with at this time.
No more questions?
Afterwards, I'll ask a couple questions of you guys if you want camera closer up.
Thank you. All right, thank you very much.